Hearts4Heart is a national not-for-profit. We support, educate and advocate for Australians and New Zealanders living with heart disease. Sure, so atrial fibrillation is the most common arrhythmia. It affects about 500,000 Australians and about 30% of those are undiagnosed. Atrial fibrillation is a heart condition where the top chambers of your heart beats fast and erratically, and so blood doesn't pump around the body as well as it should. So left untreated, it can lead to stroke or heart failure. So the treatment options are for atrial fibrillation are there's arrhythmia drugs, so rate and rhythm control, which slows down the heart rate. There's also the anticoagulants, which it's a blood thinner that prevents the risk of stroke. And there's also a catheter ablation. So catheter ablation is a non-invasive procedure where a catheter is inserted into the groin through the veins, and it sort of leads up to the heart, and it destroys the area that's causing the irregular heartbeat. Most definitely. So I had a catheter ablation, and prior to that I was in and out of emergency departments each week. I wasn't able to get off the couch or even work. I had a catheter ablation and I was in hospital overnight, back on my feet that evening, and was able to go back into the workforce and back into exercise and live somewhat normally again. Look, as mentioned before, atrial fibrillation affects almost 500,000 Australians, and so it's essential that patients have access to therapies. At the moment, we have a situation where there's a bureaucratic loophole, and patients are missing out on access to catheter ablation. So basically, what's happening is, the prosthesis list, which funds medical technology, is 15 years old, is very much out of date, and it doesn't allow for non-implantable devices. And so what that means is that patients that should be treated in the private hospital are now being pushed to the public health system. And so in some cases there are up to 1 to 2 year waiting lists. And this is just not acceptable for patients who are suffering day in, day out with atrial fibrillation. It dramatically improves their quality of life, reduces their risk of stroke. And so we've been very active in Parliament to push, well, number one, AF up on the agenda, but also to advocate for a policy change to ensure that patients have access to catheter ablations. I think that that government are listening. I think we still have a little way to go. They've recently committed to reviewing submissions for the catheter ablation, and that's something that we'll certainly be pushing for to ensure that happens, and that it's included on the prosthesis list this year. Everyone agrees that this is a problem that should be fixed and that it is a bureaucratic loophole, politicians included, so it absolutely needs to happen now. John Alexander MP, Maria Van Vakenu MP, Michelle Landry MP, as well as Mike Freelander MP. So they're all very passionate about this cause. Last year they passed a motion in the House of Representatives to really put pressure on the Health Minister to ensure that the catheter ablations are included in the prosthesis list. As mentioned, we've been advocating for patient access to catheter ablations for quite some time, as have industry members, as have the cardiologists, and so we thought to bring together a range of stakeholders, so the Stroke Foundation, Heart Foundation, industry members, the Pharmacy Guild, GPs, cardiologists, to write a consensus of what we need to do as a community to address atrial fibrillation, from public awareness to screening, and once again to put policy recommendations forward on access to catheter ablations. And once again, this is something that we all agreed on, that absolutely needs to be addressed as a matter of priority, and we launched that in Parliament House last year. The problem with atrial fibrillation is sometimes people are symptomatic and sometimes they're not. So if you do experience symptoms, then it's often palpitations, dizziness, chest pain. But unfortunately, as I said, some people don't suffer from symptoms, and those people are really the most at risk, because it's often not until someone presents in hospital with a stroke that it's diagnosed. Medical innovation is essential to improve patient outcomes, both for the quality of life and also, of course, it saves lives. In addition to that, it's incredibly important that once this medical technology is available, that patients have access to them, hence why it's so important that the prosthesis list criteria needs to be updated so it's in line with the 21st century. So medical innovation in Australia is essential for patients, not only to improve the quality of life, but to save lives. But once again, it's essential that patients have access to medical technology.